Cozy Hospital Pharmacy. This is Rachel. How can I help you? Okay. Okay. Can you spell the patient's last name? And first name. Do they have any other names they might go by? Like a maiden name? Okay. What's their date of birth? Okay. I don't think that they've come into our pharmacy before, so let me just open up a new account here really quickly. Okay. And I'm sorry, what was the last name again? Thank you. And the first? Okay. And if I can have date of birth one more time, sorry. Okay. And what was the medication? Okay. What strength? Okay. And directions? Quantity? Okay. Any refills? Okay. And generic, okay? And remind me, who was the prescribing physician? Okay. Got it. Yeah, we have your number. Don't worry. Okay. We'll get that filled. Thank you. Hi, my name is Rachel. How can I help you? Okay, yeah, your doctor's office just called with your prescription, but I couldn't find you in our system. Have you been here before? You're new? Okay. Let me just pull you up here. Can you remind me your last name? Okay. And your first? And date of birth? Great. Do you have your ID insurance card? Okay, just set it on the counter. Thank you. All right. You just moved here, okay. All right. And may I have your phone number? So here's your ID back. Are you the policyholder for the insurance? Okay. Okay, so with your particular insurance, for us to fill this medication, we actually need to do a brief examination with you. It's not a big deal. It includes just taking your temperature, your blood pressure, and doing a quick eye exam. Non-invasive, don't worry. And then your provider also approved this. It does involve placing a PPD as well. Okay? And we'll need you to come back and read the results before you start taking the medication. But we will provide it to you today. So let me just to that screen. Okay. A PPD is actually a skin test for tuberculosis, and that might sound kind of silly, but if in fact you were to have a dormant infection, this can actually mask any kind of symptoms or give you a false negative on a diagnostic test. Not saying that that might arise, but we just find it important to make sure we cover all of our patients' bases. So, we'll start by taking your temp. Okay, this just goes right under your tongue. Yep, right in the back of your mouth. Open. Temperature's in an approved range at 98.3. Okay. And then this is just going to go right around your arm. Don't worry about that. Okay. 126 over 82. Pretty good. This guy's a little bit persnickety. Sometimes it doesn't completely, there we go, evacuate all the air. Alright. Okay. Now for a quick eye exam, okay? So just focus your gaze right there, right in between my eyes, okay? And, there we go. Try to keep your eyes open. Alright. Don't turn your head at all. Just follow my light. Good. Alright. And one more step here. So we moved our chart and didn't put it back. Okay. How about this? How many fingers? Good. Good. Excellent. Okay. We'll call that good. Okay. So we do that because two of the side effects to the medication are blurry vision, as well as some photosensitivity, which can also interfere with how people see, in this particular instance anyway. So we always take a baseline so that way if anything happens, we can send our notes to your physician and they'll have an idea of where you started and where you are at that point. Okay? Okay. So then I'm going to move this out of the way for a moment. Have you ever had a PPD placed before? Okay, that's fine. So it's pretty simple. Basically, I'm going to be delivering a small injection right under the surface layer of skin. So it's going to make kind of what looks like a little blister. I will not be able to cover it with the Band-Aid because we want to make sure that if there's any kind of reaction, it's not a reaction to the adhesive, it's to the medication, okay? Which also brings me to, it's important that you avoid putting any kind of lotion, oils, perfume, deodorant, soap. Just leave it alone for the next 48 hours. Rinsing it with water is fine, just no scrubbing, please. Because again, if there's a reaction, we want to know it's from the medication, not because your skin is disagreeing with an ingredient in your moisturizer, for example. Okay? Okay. And then we'll want you to come back in 48 hours to have it read. Any of us can read it, and it'll just take like 2 seconds. We just look at it, positive or negative, and then we forward those results to your doctor's office, and they will contact you and give you the go-ahead to start the medication or tell you that they need to come up with a different treatment plan depending on what the results are. Okay, so let me just put a drape down here. Okay. So let's go ahead and have you rest your forearm right here on my paper, okay? Okay. I see you have some pretty good sized veins. I just want to make sure that we use an area that avoids those. I think we'll go right there. Sorry. Very lightly dab some of that liquid. And I just need to circle. All right. So do your best not to scratch that area, okay? Try to leave it alone. If it starts getting extremely itchy or you start noticing the area getting really red, then I want you to come in right away, okay? Okay. So let me just expiration. Alright. So now we can go ahead and fill your medication. Let me just get back. Alright. Already got two. So on the medication label, there is a QR code. We are now paperless at the Cozy Hospital, so you'll want to scan that using your phone. Every phone should have a QR reader. Okay. If you didn't know, I could have helped you find it, but good, you do. And that will give you your instructions, adverse reactions to look out for, common side effects, and also contact information for our pharmacy. So these are clear capsules that contain a tan colored powder. Okay, there are 14 of them, and your doctor wants you to take one pill twice a day for the next week. There are some side effects, common ones being nausea, some dizziness, headache. All right, and then there are some serious side effects, which can be blurred vision, photosensitivity to the point where it makes it very difficult to see. Some people call it sun blindness, tremor, and seizure. And if you experience any of those, then you'll need to contact your physician's office right away. Okay? Okay. Do not take these until we see your PPD results. So you'll need to come back in here, like I said, in 48 hours. It can be any time of day, and any of the staff here is qualified to read that for you. Okay? Okay. If in fact the PPD comes up positive, then we will be contacting your physician and they will give you next steps. We can't diagnose or provide a treatment plan for you. All right? Okay. So then, just get to the screen. So there is a stylus right there on that reader, and on the reader it's going to give you a message basically saying that I have given you the instructions and explained the reactions, and you're going to sign saying that you understand and that you will return in 48 hours to have your PPD read. Okay. Yeah, whenever you want. Great, okay. So I show for this medication that you have a copay of $4.37. You can just tap right there. Great. Okay. And would you like a printed receipt or email? Email? Okay. What's your email address? Alright, that should be in your inbox, or at least on the way. Is there anything else I can do for you? Okay. Well, then we'll see you back in 48 hours. You take care.